Hello, I'm Dr. John Ward, a consultant anaesthetist at RBH and have a clinical leadership role in our surgical care group at Bournemouth. I'd like to update you on the plans for our local secondary care here in Dorset. We all know someone who has had their planned operation, such as a knee or hip operation, cancelled or postponed because of emergency surgery taking precedence. This can be particularly true around winter, with added pressures on our hospitals and our NHS. The NHS has recently published its long-term plan, and one of the national recommendations is for separation of urgent from planned services. This is something we are already planning on doing in Dorset. It'll make it easier for hospitals to run more effective emergency services, and planned care will then be protected to reduce the risk of operations being postponed at the last minute due to more urgent cases being admitted. Managing complex urgent cases on one major emergency site will also allow the Trust to provide improved assessment, triage and management of these most poorly patients. There will be better immediate access to specialist care, and therefore patients will get the right expertise at the right time. Across the NHS, this model has improved survival and reduced complications from major illnesses and trauma and conditions that require complex management. A real working example is the improved outcomes from stroke care when this is provided in such specialist units. You'll be aware that the Dorset Clinical Services Review made the same recommendations for East Dorset, with the Royal Bournemouth Hospital becoming the major emergency centre for the whole region, and Poole Hospital becoming the major planned care centre. This has been supported and recommended by many local clinicians, as we all know that it's better to have emergency services offering 24/7 care in one fully resourced hospital. It will improve patient outcomes at the major emergency centre, and we know it will also reduce the frustrations for patients who have had their planned care cancelled or postponed. This is an exciting time for health in Dorset, as a significant amount of money is being invested on achieving these changes. There will be improvements in buildings at both hospitals, and while there may be considerations that perturb some people, particularly in regard to the time spent travelling, please be reassured that these changes have the best interests of the patients at heart.